Today in the United States, there is a crisis of opioid addiction, overdose, and death. Annually, more Americans die from prescription drug-related adverse events than from car accidents. As a result, medical providers, hospitals, and pharmacists are being aggressively investigated and criminally prosecuted by state and federal authorities nationwide. Whether or not this should be happening to healthcare professionals, it is happening. When a doctor prescribes FDA-approved opioids to patients as part of a medical practice, and then gets arrested for drug trafficking and is branded a drug dealer in a white coat, it's noteworthy. It took about 20 years to get to where we are, and if this problem were a spot on a map, it would be at the intersection of Treatment Gap Terrace, Opportunity Avenue, Profit Place, and Blame Boulevard. First, Treatment Gap Terrace. Years ago, doctors weren't adequately treating their patients' pain, and this soon became a major public policy issue. Legislatures nationwide held hearings, heard from distressed patients, and passed new laws acknowledging that many patients were in excruciating and intractable pain and that doctors needed to respond and treat it. Medical schools and the medical profession soon followed suit and vowed to recognize and treat chronic pain as its own distinct medical condition. Second, Opportunity Avenue. Drug manufacturers saw an opportunity. They funded and conducted studies which reached the surprising conclusion that the same opioid painkillers which had always been limited to acute and end-of-life pain treatment because of strong addiction potential were in fact safe and generally non-addictive for treatment of chronic pain. We know today that these studies were incomplete and flawed. But back then, the Federation of State Medical Boards and the drug companies helped persuade the FDA to approve powerful painkillers, most famously OxyContin, for chronic pain treatment. Third, Profit Place. With FDA approval obtained, drug companies spent hundreds of millions of dollars in advertising and have made billions ever since. Today, 90% of the world's hydrocodone is prescribed and consumed in the United States. To be sure, these drugs are important and helpful to many, many people. None of us can judge a patient who, but for opioid painkillers, can barely get out of bed in the morning or function normally. But the unintended and devastating consequence of mass prescription of opioid painkillers for chronic pain is the public health crisis we experience today. All of which brings us at last to Blame Boulevard. The drugs turned out to not be as safe and generally non-addictive as the drug company-backed studies said. Prescription rates and sales numbers soon nightmarishly correlated with sharply increased overdose and death rates. Ordinary Americans seeking relief from chronic pain soon found themselves dependent on prescription drugs containing the same active ingredient as heroin. Law enforcement agencies, like the Drug Enforcement Administration and state medical boards, reflexively looked around for someone to blame, and they quickly settled on the doctors who were prescribing these powerful narcotics. In some truly exceptional cases, law enforcement agencies have gotten it right in targeting doctors. More often, though, they have been wrong, or reckless, or have equated a badge and gun with medical training and expertise. It is a persistent and dangerous law enforcement oversimplification to blame doctors for this public health problem. The problem's genesis was complex and multifaceted, as we've seen. Even though doctors and hospitals and pharmacists were the last in on the issue, prescribing FDA-approved drugs, following recommendations and guidelines developed by national medical societies and state medical boards, healthcare professionals have been targeted first. In the face of this real and dangerous threat to medical practitioners and pharmacists, healthcare professionals need to know how to protect their patients and themselves while always doing the right thing medically, legally, and ethically. In the remaining segments of this web video series, we will talk about how you and those whose job it is to protect you can learn to do that. I welcome you to call or email if you have any questions or if you need help. Remember, you would always tell a person you cared about to go see a doctor now, not later, if they thought there were a medical problem. You deserve the same consideration and care before the fateful knock on the door from an agent carrying a search warrant and ready to do you harm. Follow your own good advice and practice legal wellness. It's just what the doctor's lawyer ordered.